ready to master the waves of medical device product development? Well, wax up your surfboard because you are listening to Inspired by Imua. And here is your medical device product development expert, that Hawaiian-hearted hostess who will help you hang 10, Meghan Alonso.
And aloha! You're listening to Inspired by Imua, where we help you master the waves of medical product development. Each week, we interview guests that educate, guide, and inspire to give you and your product the skills you need to hang 10. If this is your first time listening, Imua is spelled I-M-U-A, and it's a Hawaiian word. It means to advance forward with passion despite rough waves. There are plenty of those in medical product development, but keep listening because we've got you covered. All right, so next week I'm headed to San Diego and Irvine, so I guess technically just Southern California, and I've got a few deals for you. So if you are in the in vitro diagnostics industry, I'm going to be at AACC, which is American Association of Clinical Chemistry, so I'll be there at that conference. We can connect. And I also have a deal for you. I have a very special guest on today, Dan Golka, that's hosting MedTech Monday on August 7th. That's in Irvine at the Atrium Hotel. And you can register for that. Be sure to use the code IMUA, I-M-U-A, at checkout for a discount. But you got to do it really quick because that's going down in a few days so they can print badges. I forgot to mention AACC is August 1st through the 3rd, and that's in San Diego. So anyway, let's move on to talking with Dan. And if Dan Golka, if that name sounds familiar, you're right. It's because I talked with him on episode 38, where we had a great discussion about the last MedTech Monday event coming up. And we started talking about social media just off the cuff. That time we were in a restaurant. And so it was a very, very casual interview. You hear glasses in the background and waiters and waitresses and music. So the audio on this one is actually quite better. Before we jump into the interview, I just wanted to let you know, if you haven't heard, that I just saw the statistic the other day that most successful CEOs read at least 30 books per year. So if you don't have time to read that many books, you definitely have time to listen to that many books. So I have a deal for you. You can get a free trial of audible.com and listen to great audiobooks. So I even put something together for you to, in addition to getting a free audiobook from audible.com, you can also be part of my monthly book club that I have, where we read or listen to a specific book and then just chat about it on Fridays. So go check that out. It's imua-services.com/free book. Okay, let's jump into the interview with Dan Golka, creator extraordinaire of MedTech Monday and the MedTech Council. So Dan, are you ready to hang 10?
I am.
All right. So we have this MedTech Monday conference coming up soon. And the one in January was spectacular. This second time around, what's different? What are you looking forward to?
Well, the advantages to having a second conference is it's much easier to get speakers. It's much easier to get attendees. And, we had a great event in January, but this one is going to dwarf the size of January speakers. We have, I think, a better group of people. We've got better startups right now. It's just going to be a better event all the way around.
Mm-hmm. What are some things that you're really excited about?
A couple things. Just, with a smaller event like ours, we're a little more fluid where we can change the agenda around at the last minute. And 2 last minute additions. We have an actual doctor from the FDA that's coming out to speak. And Dr. Brullo is fantastic and handles the medical device and things with the FDA. And he's going to speak about medical devices at our conference. And also, we just got notified that Jim Mayfield from the Department of Commerce is going to come out and speak. He handles exporting of medical devices and is going to talk on that subject too. So we're very excited to have those two people in addition to everybody else that's going to be there.
Oh, that's awesome. Yeah, I'm really looking forward to that. It's just a interesting topic. Other conferences, I haven't heard much about the importation and exportation, which is huge when you're thinking about, okay, hey, where am I going to manufacture this? Or where's my facility going to be and where are my markets? And this day and age when things are global, that's definitely something that you need to think about way in advance. And you should have set up those channels way ahead of time too.
Absolutely. One advantage you and I have in this industry is that we get to attend a lot of conferences. And one thing that I see a lot of the same people speaking at events. I see a lot of panels on boring subjects of people's mergers and elitist CEOs that come in and speak and then leave out the back door. And they're great people and they're very well respected, but our event is different. And I like to see different things. We have talks that are much shorter. We have a 20 to 25-minute talk on each subject, followed by a startup presentation, and then another talk. Right now, we only have one panel today, and that's going to be Women in MedTech. And like you'd said, we want to see something different, something you haven't seen. We have a couple different things as far as alternative financing that are different with our conference. We have an expert, Rand Brenner, who buys and sells medical device IP. So if you have a startup and you're at a certain point and you don't want to have this 10-year challenge and you want to sell your IP, Rand is the perfect guy to deal with, because Rand has done this time and again, came from the entertainment industry years ago and now is exclusively in the medical device IP area. And it's exciting. We have different talks, different people, and it's just going to be a great day all the way around.
Yeah. And I really did like that about your talk last year, because let's face it, there's several conferences that I've been to where the talks are way too long and people just go on and on for like 45 minutes and you look around the room and no one's paying attention anymore by that point. And so why even have the speaking slots that long? And you can fit more speakers in there if you have them shorter too.
Absolutely. And that's the advantage to this. We have a lot more speakers. And being a smaller conference, we have invitations out to people. Even with 2 weeks to the conference, we still have people accepting our offers right now. So the agenda will change between now and event day, but it's going to be a stellar day. And I am excited about every aspect of it, because you're going to see people that I want to see talk, but you're going to see a different group.
Mm-hmm. So you guys have startup presentations. Last year, that was really, or I say last year, that it was still this year. In January, we had that, and that was pretty cool to see. So tell us about some of the startups that you have presenting this year.
Well, we have, three off the top of my head, the last three that signed up. We've got a company that does a neurological testing process. That is very exciting, because they do something different for migraine headaches that I haven't seen. I have never seen this before. And that's one. We have a company that has a medical ID that is going to revolutionize how you carry your medical and healthcare information with you. So it's an online service that they have that is completely unique out there, and it's going to revolutionize every aspect of healthcare. And another one is a company that does blood withdrawals. Instead of, from someone who was recently in the hospital and had to have blood taken out, it was, a horrible experience to be pricked like a pincushion so many times.
Yeah.
This company developed something that you press a button and it does a blood withdrawal on somebody. And the cool thing with that is, imagine if you had someone disabled, you had someone that maybe had mental issues and couldn't handle the needle situation. You had somebody elderly or somebody incapacitated, and to be able to draw blood and test it without having to get a vein is just unbelievable. So those are three of the people that are going to be there. We are constantly adding to the startups. We only let certain people present to the entire group. We will have many startups in the audience, and that will be there looking for the VCs, because we do have a large VC contingency coming this time. And it's exciting. that'll be narrowed down. Their speakers, the startup presentation slots will be nailed down between now and event day. But
yeah, well, I'm excited for the blood withdrawal startup. That sounds really intriguing and just makes several people's lives easier. Yeah.
Something that when I went to these two gentlemen, they're young guys and they really have something cool. I said, I've just never seen this. And, it's what needs to be presented in front of a group like this, to see what's different, to see what people are working on. Plus, as of this morning, we just got notified that one of the local colleges is going to add a contingency of their students. They have a startup group, and I have to sign everything this afternoon, so I can't say the name of that college yet. But we have a startup group that's bringing a minimum of 3 to 5 startups that have won competitions in medical device and biotech, and it's just incredibly exciting.
Yeah, that's great. And it's always nice to see the startups at different points. So what are the ones doing that are just starting out and they're really brand new? They don't have their sea legs yet. And then you can get a look at the more mature ones, like maybe they're seeking some angel funding. And then you see the ones that are seeking Series A and then B and C. It's just huge leaps. And so it's cool to just see that across the spectrum.
Well, that's the other thing. We're inviting back startups that presented last time so they can see where they're at. And we know that people got investments from our last conference, and we know that some of these companies, they're all growing. One company is just doing an unbelievable job selling. So it's nice to, like you said, to see where they start, where they're going, and even in a 6-month period, how these companies have changed and how they may have raised millions of dollars. And what's different about the climate today than it was in January.
I'm looking up because Echo Labs spoke at your event, and they were given an award recently. Oh, I wish
that's the company that has sold millions of dollars.
Yeah,
that microscope, and it's just a cool. When you say this. It's a microscope that fits on an iPad. Now, it's a surgical microscope that has application to imagine if you were under the knife and a doctor needed to look at something, instead of sending it out to a lab, to be able to look at it right there. And the magnification and just how clear it was absolutely amazing. And again, that's a company that I saw, late last year and said, you have to come to my event because it's something I haven't seen before.
Yeah.
And they're an established company. They've raised a different series of rounds for money, but now they're selling millions of dollars of product right now.
Mm-hmm. Yeah, I thought maybe it was something I could pull up really fast here on Google, but yeah, I know I know. Yeah, so I'll have to I'll put it on the show notes page when I find this. Okay, so you are pretty big with the MedTech Monday conference. And you also have, for those listeners that haven't heard of this, Dan also runs a group called the MedTech Council, which you got your roots in Orange County and San Diego, and you're expanding. So why do you think it's important for people to be active in the MedTech community and attend conferences and attend networking events?
The most important thing that anybody can do right now is collaboration. And our theme in January was innovation, collaboration in the year ahead, and now it's innovation, collaboration, and finishing the year. And right now, in our space, as good as business is, and I'll use your analogy of surfing, we're riding this wave of business right now, and the wave is going to break at some point. It's going to crash, and the thing that's going to be left is who you collaborate with and the people you work with. And it's so important to have a network of people that are from every aspect of this industry, because what I've learned about this industry is that it is broken, it's fragmented. There are so many lawyers that need startups. There are so many startups that need access to money. There are so many money guys that want to meet the startups, consultants, everybody in between. And what I've learned is that by putting these people in the same room and having a diverse conference like mine or a diverse mixer like I do, it gets people together and they get business. And you and I are marketing people. We're very good at marketing, but we need to get people more business. And that's what the MedTech Council is all about. We started it in Orange County. We've had just fantastic results. We moved to LA and had a great mixer up there. We went to San Diego, and that was insane because we had, over 90 people that attended that event. It was just nuts. And, we're going to move across the country, and we'll be in 12 cities by the end of the year. But for an inexpensive amount of money, you can join a group of people that's going to get you business. You're going to network with other people that, are people looking to have their phone ring. And that's what we do that's different. And it doesn't matter if you're an engineering company in our space, or you're a consultant, or you're a medical device company, or you're a lawyer. You can benefit from meeting more people and getting more business.
Mm-hmm. Yeah, you can never know too many people.
Absolutely. And, one thing, Meghan, is, you have just such, you have this huge network of people that you are, and you're different. I mean, you can call these people on the phone tomorrow. So it gives you a leg up that other people don't have. Now, the cool thing about putting you in these people is that so many people. If a startup was having an engineering problem, he was having a design problem, or we're trying to print this with a 3D printer, you would know who to call in a second. Well, that's the advantage to these events, is that you meet so many people that may not have Meghan's connections, but they have connections, and they want to meet other people. So it's also cool to have lawyers and to have other people that you would generally have to pay to sit down in front of, freely talk with you about, questions you can ask and problem solve.
Yeah, your network is your net worth. And I've built mine over several years, but just the one person, what is it? The rule of Kevin Bacon, or, you're always connected to people. You may not think you know a lot of people, but if you start asking people for recommendations, they love helping and they love connecting you to their network. So you can always find what you're looking for. You just got to ask.
The problem with this industry is we have so many smart people that don't do that, and they don't ask for help. And the cool thing that I'm seeing is I'm seeing some really good law firms and lawyers that represent startups, and they're starting to come out to my events more often on a regular basis, and bringing the associates and bringing other people out. And it really is, it's expanding their network, it's expanding, what we're doing, and we're just seeing a really, really good turnout all the way around.
Mm-hmm. Yeah. So speaking of that, that's one of the obstacles. What do you think is the biggest obstacle that our industry is facing, and how can we overcome that?
Well, right now, I would say the biggest obstacle is the access to money right now. And one thing I'm seeing that's different with the money end of our industry, which fuels everything, is that the money guys are getting fed up with not having a clear picture. And even in the 6 months since January till now, what we're seeing is the money people want a clearer picture from every aspect of it. And I'll give you an idea. I met a realtor who deals only with venture capital now, and he deals with the startups, because these people would go out and get sometimes millions of dollars and go rent a very expensive office and are in front of this cool office. And the venture capital people are saying, "Nah, we don't want that anymore.
Yep.
We want to see where every cent of this money is going to go, and we want the burn rate to be, incredibly slow." The realtor, I had lunch with this guy, and it was fascinating because he was talking about how, they want you to have your office in a cardboard box with a string phone and save as much money as possible. They don't want any frills, which is just how it should be. This is not, the cool kids, and isn't this a cool place? Because no one, I don't care where your office is at. I don't care. The people that are more productive are in shared spaces, are in, the Regis type setups that have a common receptionist, and have access to a conference room and you can meet with, but they're productive and they're spending, a minimal amount of money each month.
Mm-hmm.
So that's the thing that I see. And once the money dries up, then everything else is going to dry up. So that's what led me to all these other alternative financing sources, is that people are going to remember MedTech Monday in August. And why I'm saying that is that they're going to remember it when the economy changes, and it's going to change. It's going to make a shift. It's going to be tougher to get business, tougher to get money. You're going to remember this guy that brought a licensing IP guy who's going to save some people's lives as far as their businesses when he sells their IPs and they cash out to these big companies that Rand works with. And to be able to export your product, I have people from Europe, people from the Philippines, people from Thailand, people from like Jim Mayfield that are coming that are going to help you export your product and give you an ease to market that you generally wouldn't have. Because let's face it, I know nothing about exporting, but these are people that are experts in that field, and it's important to get them in front of you and in front of a group like mine. I could go on for an
hour. No, that's true. I've seen that also with just access to capital is getting harder and
getting smarter too.
Yeah. And startups have to have their ducks in a row. You can't just go up there anymore and say, hey, look at this great opportunity. This is a great opportunity. I hear that all the time. And VCs are smart. They want to see, okay, what have you done? What have you done with the money that you've gotten so far? Or what have you done with your savings? And what's your marketing position? How are you leveraging your IP? Tell me about your regulatory strategy. Like everything has to be worked out in advance.
What we're seeing with the clinical research companies like NAMSA and APS is that their strategy is shifting more towards when they get somebody in there to do testing, that they understand that the money that they spend today is going to save them money in the future if they do it correctly and they hire it like that, instead of hiring a smaller company that may be less expensive up front. When you go and you get great companies like APS and NAMSA to do your lab work and certain clinical research, it really does save people money down the road. And that's, again, what people want to see. People want to see that they're getting, value for their money and a bang for their buck and getting to the finish line as quickly and as expeditiously and as inexpensively as possible.
Mm-hmm. Yeah, I've seen lots of people try to take shortcuts and do it the cheap way, and then it bites them in the butt later on. Like you should have done it. You should have spent 20% more and done it the right way the first time. Yeah. You wouldn't have to do it all over again.
And you've seen this with marketing too, Meghan, where people will, I just want to try this. Let's just try this one segment. I like your plan, but we just want to do this one side. And it's a third of what they should be doing, instead of going gung-ho and turning someone like you loose to where it's going to be, value and money well spent. Sometimes people, don't look at that up front, and they should.
Mm-hmm. Yeah. Well, Dan, I'm going to conclude by asking you 2 questions about advice. But first of all, I want you guys to know that the most successful people in the world make reading or listening to books part of their daily routine. So Warren Buffett, Elon Musk, Oprah Winfrey, Mark Zuckerberg, and Bill Gates, all of these people read more than 30 books per year. If you want to be successful, you have to have the habits that breed success. I like listening to books while I'm walking Abby or cooking or getting ready. And you can too with a free trial from audible.com. So get a free book along with being in my book club where we can talk about what we're reading over at imua-services.com/free book. So Dan, I want to close with you by asking some advice. So what's the best advice you could give to a medtech startup today?
I would say collaborate. And you don't have to share your IP and the secret sauce that you guys are working on, but reach out. Reach out to different people. Look at people within your industry that have had similar situations. And by meeting these people and talking to them, it will just save you time and money. And I really believe that collaboration is the number one thing anybody can do. And that includes going to conferences like mine, networking with people, going to mixers like yours, Meghan, and doing different things to get out there and to find out who's having issues like you're having. And that will save you time, save you money. Plus, you're going to meet some really smart, intelligent people in our industry by doing that. So.
Yeah, innovation doesn't happen in a vacuum, and you can't do everything alone.
Absolutely.
So what's the best book you can recommend for a MedTech startup?
I will do two, and that is number one, Meghan, I love your Put a Shark in Your Tank. That was a great book. You had collaborated on that. I love that. And it's funny, my 16-year-old son is a social media phenom that as much as I tried to stop certain things that he's doing, I can't. He's got over 30,000 Instagram followers and has been hired.
Wow, that's great.
Yeah, he's an influencer. And I recommended Think and Grow Rich, was something
Yes.
that me read when I was the exact same age as him. I was a sophomore in high school. My dad recommended that I read it. And I recommended my son read the same thing yesterday too. So I think that's a great book that everybody should read. And it's funny, I'm going out today to buy it, torture him to make him read the book.
Well, it's funny that you say that. So collaborate. And then you mentioned that was the best advice. And then you mentioned that I collaborated on that book. So if you guys haven't heard by now, I collaborated with Shark Tank's Kevin Harrington. He was one of the original sharks on the TV show. And the reason I got to know him was from networking. I met him through a friend who that friend met him through another friend. And actually the friend that I met him through is a big advocate of Think and Grow Rich. And I actually supported I can't remember if it was Kickstarter or Indiegogo, but they had a crowdfunding campaign to make a movie about Think and Grow Rich that's going to launch this fall. So I was a part. Yeah. So I'll keep you posted on that. I was a part of that. And you may think with the title that, oh, is this all about making money? And it's totally not. It's about how can I add value to people in my life and put a desire by something that I want. And it's just an amazing book.
My son is working in this new medium, in social media, and making money in it. And it's just certain things hold true from 100 years ago. So some things have not changed when it comes to marketing, is what I'm getting.
Yeah, definitely. Well, thanks for being on the show today. And it's great to have you back. And I will see you in, is it 2 weeks?
It's less than 2 weeks.
Wow. Crazy.
You know of any crowdfunding experts? I'd love to have them at the event. That's the one thing that we can't get locally, and that we haven't been able to find someone that would be a good speaker on that. I know you've dealt with some people that have been in the podcast that would be fabulous for this, but we're all ears to have some more people.
Okay, and that's a call to action to you guys listening as well. If you know anyone, let Dan know. Speaking of letting Dan know, if you're interested in going to the conference, which you should be, and let me know. I will be there. I'd love to meet you. How can people register?
They can go to medtechmonday.com and register.
All right. And it's in Irvine, California, right across the street from the airport. You don't even need a car. Just walk across the street.
Yeah, exactly. That's the cool thing. We have one day last week, I was so excited because we had 12 additional tickets sell, but 8 of the 12 people were flying in from around the country: Boston, Nashville, Atlanta. I mean, it was super cool. It was just that these people are all coming in, and you could literally throw a baseball to the hotel from the airport. You get off a plane and you can walk across the street to the conference.
Mm-hmm.
We're feeding everybody breakfast, lunch, cocktail reception. It's going to be a fabulous day all the way around.
Yeah. All right. Well, see you there, and thank you. Guys, I hope you got a lot of great insight from that interview. That was really cool, where we talked about what's coming, what's going to be at the event, and then just things in general happening in medtech and where the industry is going, as well as his killer advice. So go take action, go check out Put a Shark in Your Tank and Think and Grow Rich. And hopefully I will see you in Southern California next week. Until then, Imua.
mahalo for joining us. If you're new to riding the waves of medical device product development, or if you've been in development for a while already, Inspired by Imua is here to surf with you. Want to be a master of the waves? Text HANG10, that's HANGTEN, to 44222. We'll send you the most common wipeouts companies make in product development so you can avoid them and reach master wave status. Again, that's HANG10 to 44222. We publish a new episode every Tuesday, so catch us at inspiredbyimua.com. Imua!